My name is Axel Gräwingholt. I'm a radiologist from Germany, and I would like to present to you on ProFound AI and ProFound AI risk case study. I am a radiologist specialized in breast imaging, co-owner of a private radiology institute in Germany with a screening unit for the German official breast cancer screening program. I'm also involved in several screening programs in Europe as a reader in Germany, Switzerland, and Norway, and my workload is between 10 to 15,000 mammograms or tomos per year. We have been participating in a large trial in Germany called the TOSYMA trial to assess the value of tomosynthesis in organized screening programs. At present, since 2017, I'm clinical co-chair of European Guidelines for Breast Cancer by ECIBC, the European Commission Initiative on Breast Cancer, and I'm also a lecturer on courses about mammography or tomosynthesis, mainly in screening. I would like to present a case to you to demonstrate the use of the products iCAD provides us with on their platform PowerLook. Now, patient's history is a 73-year-old woman who came for opportunistic screening in 10/2020. Before that, she went to the screening program in March 2009 at the age of 61, in February 2011 at the age of 63 after a 23-month interval, in January 2013, aged 65, also after a 23-month interval, and then in 11/2015, aged 68, 34-month interval on her own decision. Her next screening in the regular interval would have been in 11/2017, but the woman turned 70 in July 2017, so she did not get invited. In October 2020, she came without symptoms for routine diagnostic mammography or opportunistic screening, choosing to opt for 3D mammography on her own expenses. I will show you now a series of screening exams. All these screening exams are part of the German National Breast Cancer Screening Program. Now, the woman's screening 2009, you see the CC views and the OBL views. On the right side, there is at 12 o'clock a well-rounded mass. I show you that in a more detailed way. On these images, you can see it well. It is well-rounded and there are no undefined margins. On the left side, we didn't see anything. Now, the case was dismissed by two radiologists as a benign finding because of that well-rounded mass at 12 o'clock in the right breast. Retrospectively, we added ProFound AI when we found the cancer in 2020. It detected a lesion on the right side with a lesion score of 33, and in the MLO lesion score was 36. Altogether, the system assigned it a K-score of 47. Now, in 2011, the woman presented again at the screening, and what you can see is the same well-rounded lesion at 12 o'clock in the right breast. Again, I show you the detailed images. And again, it was dismissed by two radiologists as a benign finding. It was the well-rounded mass at 12 o'clock in the right breast, and the radiologist decided there was no change to the priors from 2009. Now, in 2011, also retrospectively adding ProFound AI, the system gave us a lesion on the right side, detection score of 36 for that lesion, and in the OBL image it was 38. Altogether, the case had a score of 50. Then 2013, the woman came again to screening. Again, you see the lesion on the right side. And going more into detail, you can see it is still a well-rounded lesion, maybe a little more dense than before, but still dismissed by 2 radiologists as benign findings because there was considered no change compared to the priors. Adding ProFound AI retrospectively again shows that the lesion score is now 48. The lesion score, also the system detected 2 small lesions on the left side, and the lesion score on the right side, OBL, was 58, and the case score was 70. Now in 2015, again, the case showed the same lesion. Here, we must say retrospectively, also a radiologist should have seen that there are slight changes in that lesion, and there were no other signs. Anyways, it was dismissed by 2 radiologists as a benign finding again because they said it didn't change much to the priors. It was labeled as unchanged. Adding ProFound AI to this case retrospectively showed a lesion score in CC of 50% probability, and in the MLO a lesion score of 82 or 99 probability. The case score for the overall case was 99. The diagnostic exam in 2020 was done as a tomosynthesis with ProFound AI added right away. What you can see is a marker, and when you click on that marker, you jump right into the correct slice. This is how ProFound works. And the lesion score for this lesion was 86. And in the OBL images, it was 80. The case score was 98, so a very high probability that this would be a cancer. I show you again the evolution of the images from 2009, 2011 to over 2013 and 2015 in the CC view, and again in the MLO view, where you can see that gradually the case score and the lesion score increased. As I said before, this was all retrospectively done after the diagnostic exam of 2020. We did do a biopsy in 2020, and histopathology revealed an invasive ductal cancer, which is purple on the histopathology chart next to mastopathic tissue, which represents the well-rounded lesion that we could see all the way from 2009 to 2015. Probably the mammographic images of 2018 and 2015 were masked through the benign lesion for the radiologist, so they couldn't see the tumor because of superposition. ProFound AI already detected the subtle changes to this lesion and assigned higher lesion scores and a higher case score in 2013 and 15 already. Now I would like to show you the retrospective evaluation of the risk with ProFound AI risk on this case. From 2009 to 2015, the risk increased gradually. It went from moderate to high in 2013, and again even higher in 2015. Comparing the scores of ProFound AI over the time from 2009 to 2020, you can see that K-scores, lesion scores, and risk scores increased gradually. This graph on the right side shows you the individual risk of the woman in the green line, whereas the average risk of a woman in that age group is demonstrated in the blue line. You can see clearly that her risk increased between 2011 to 2013 and from 2013 on to 2015. Conclusions. If in 2013, because of the high ProFound AI risk score, supplemental screening, for example, ultrasound, CSM, or MRI, would have been added, there is a high probability that a very small cancer could have been found. If in 2015, because of the high scores both in ProFound AI risk and ProFound 2D, supplemental screening would have been added, the cancer would have certainly been discovered. In 2020, 5 years later, the diagnostic exam with ProFound AI 3D revealed the correct lesion with a very high K-score, a very high lesion score. Invasive ductal cancer was confirmed by the histopathology report. In this example, the cancer diagnosis would have been detected 5 years earlier in 2015. Optimally, it could have been detected even 7 years earlier in 2013 if ProFound AI and ProFound AI risk would have been available, applied, and used as a decision tool for supplemental screening. Thank you very much, and please email any additional questions to the link you see below.